Hi, this video is the art of hair transplant restoration surgery on a Caucasian guy who we're gonna harvest by the FUE method to restore his hairline. He has a receding hairline in corner, and so with receding hairline, his forehead's getting larger, and it threw his look off, and it's not proportional. So, and from the mid eyebrow to the hairline, to the tip of the nose, and tip of the nose is a little bit small compared to the overall of the frontal forehead. So I'll go to frame the face better using by doing the hairline lowering. On average, from the mid eyebrow to the hairline for Caucasians around 7.5 centimeter. The measurement is from the mid eyebrows here, okay, and you measure and comes up straight like this. So his is roughly around 7.5 centimeter to be exact, almost. Now again, 7.5 to 8.5. It doesn't have to be exactly the same as long as it's proportional to overall a third. Mid eyebrow to the hairline is a third. Mid glabella to tip of the nose a third. Tip of the nose bottom chin's a third. When it's that proportional, then it frames the face better. And the more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. And so that's how you're gonna find the height of the hairline and all the stuff. For Asian and black, it's around 6.5 to 7 centimeter. For Hispanic, it's around 7 to 7.5. Oh, it could vary, depend. And again, when I create the hairline, I create it according to each individual facial structure, because it's very unique for each person. And according to the facial structure, how narrow, how wide, how big the head is. Once we get the shape down, we will transplant a very precise angle at 35-45 in the front, changes when you go backward, and changes when you go different direction. Not only precise angle is important, the selection of hair grafts is important. We transplant rows and rows of single graft in the front, followed by ruticular 2 hair, 3 hair, 4 hair in the back for bulk and volume. The goal in the back is volume and density. The goal in the front is softness and naturalness. And then when we make site, and that I will be personally making site, we had to measure each hair follicle according to the individual hair instrument, because when I make the hole, it had to fit perfectly. So the size of the hole for the ruticular 1 hair is different from the size of the hole of the ruticular 2 hair versus 3 and 4. So why we have an exact measurement? It is an exact science, to tell you the truth. Why? Because if you make such a small hole and try to squeeze a big hair follicle in, you force the big hair follicle in, you destroy the root, and thus it leads to poor growth. Likewise, if you have such a large size of hole and you put a very thin hair follicle in, it can fall off easily, or it has or it sink in and it causes ingrown hair, or it has a little bit too much room and there's aeration, and then it can lead to dryness and the hair follicle will die. And so to precise angles and the precise size of the hair follicle is very important. And again, hair transplant is not just the surgical skill of the surgeon, it requires the exact science. And then the artistry, as I mentioned earlier, is very, very important. Why? Because with the artistic and aesthetic detail of the hairline, and you pay attention to every single one of them, and you make it perfect, then the face will comes out into reframing the face and enhance the eyes and nose and all the features that God created. The old thinking and the old hair transplant ways, they like to do the hairline almost half of the head, a very high hairline. And they're not really wrong, because the old goal is, you should be happy just have hair. But the idea rooted behind this old way of thinking with the high hairline was because the growth rate was very low, and then just in case you don't have enough, you rather have hair up here, because if you lower too much, then you eat up too much graft and the growth rate is poor, then you don't have enough to cover for everything. Nowadays, the growth rate should be very high and the density should be there. So having just having hair is not good enough. Having hair that's natural and a perfect hairline for you, and that's what we always strive to have. And for this client, I'm going to go on my way trying to give him the best perfect hairline for him. And then And then we will harvest by the FUE method. And as you see people advertise so much on the FUE online, but you have to be careful about FUE because FUE is a term mean follicular unit extraction, pulling one root at a time. It leaves you thousands of dots of scar, allow you to shave your hair shorter. FUE, there's three different groups. One of the FUE specialists like me who personally pulling the hair graft out. So the question you always ask the surgeon when you come and interview with the doctor or the clinic is the surgeon personally pulling the hair graft out? Do not ask if the surgeon doing the surgery. By making sight, anybody can say they're doing the surgery, even though they don't pull the hair graft out. But why it's important the surgeon got to pull the graft out? Why is because with this very technical skill and the eye, the hand coordination, and the other part of the skill, it determines how healthy the roots is and the least transaction rate. And the surgeon with the technical skill should be able to harvest it out. The surgeon who cannot do the FUE, but they can do a strip, so they end up buying the robots machine, neograph, the artist. The artist will not be able to harvest the healthy graft straight out as much as the surgeon who specializes in the FUE. Despite the fact they advertise that much. And then the least growth rate is the neograph, and the neograph is technician operating, so there's no comparison when that versus the surgeon operating and personally pulling the hair graft out. So it's very important. Yes, of course the neograph is cheaper, but then you get what you pay for. And you look at all my work, and you can always go on YouTube and type of Dr. Diep FUE hair transplant surgery result with before and after photo. You can see how my work is, but I will be personally pulling his hair graft out. So to make in conclusion, if you want more of my work, just go on YouTube, or you can go to my website at www.mhtaclinic.com, or call 1-866-999-6482 or 408-356-8600. Thank you.